This is the Dirty Lou Podcast. This week's guest, Carolyn McNamara FNP.
Got it.
All right. So today on the DL podcast, we have, Carolyn, I don't know your last name.
Correct. Just
You don't
Carolyn.
need to go with that.
Just Carolyn?
It's a mononym. No, I'm just kidding. Carolyn McNamara. Hi.
Do you want to tell us a little bit about yourself, what you do?
Sure. I'm a nurse practitioner at B Street. Work with Duke here. We take care of about 5,000 patients for their primary care needs, kids, families, adults, people who live in Lewiston and beyond. We got patients all the way up past Rumford and just provide full service family health care. So,
Might add, we have patients from all over the world, you know?
yes, depending on
How do you have patients from all over the world?
Well, I mean, I think all doctors' offices do, but, you know, I think we'll probably get to it at some point, but B Street, where we work, is like a hub of, like, you know, the Lewiston immigration community, really, in a lot of different ways. Carolyn, I think, has more knowledge than I do, but since I've worked there, I've understood how important our doctor's office is to the immigrant community and some of the services we offer. It's we are affiliated with St. Mary's. We're under their umbrella, but we work for Community Clinical Services, which is its own, you know, I don't want to say company, but it's its own thing.
separate 501c3.
And they are very, very much geared towards helping out the less privileged and brand new immigrants to the state. Right?
Yep.
Anything you want to add to that?
No, I think it was really amazing. Actually, we had a guy come back for a vaccine clinic. He's a professional in Portland now, and he had lived in Lewiston for a couple of years back in 2002. And he had gotten his first vaccine somewhere, and the site ended up shutting down, like a lot of these mass vaccine sites are. And he just showed up on a Saturday at B Street. He didn't know we were running a vaccine clinic or anything. He just said, I always knew that if I ever needed anything, I could come back here, and now I need my second dose. So I figured you guys would be open, and there we were. We gave him his second dose. So I think it's really just word of mouth more than any special service we provide.
And word of mouth, like literally, we have people come in off the street and they're just like, I fell, you know, and they, like I would get a call out, or Carolyn would, and we'd go up front and we'd be like, oh my God, well, your arm is swollen. Maybe it's broken. Do you have a doctor? They're like, no. Like, do you need one? They're like, oh, I need help. So I've seen us have people walk in, sign them up on the spot, get them like a chart and paperwork, and then all of a sudden we're just having an appointment with this person that kind of showed up. And that doesn't happen other places.
No.
Not as far as a doctor's office goes. I remember it was a guy
not from
who
a doctor's office. More clinics.
Yeah,
tend to have that
exactly.
style, don't they?
We operate in quite the capacity.
We try to be flexible. We respond to the needs that arise.
Are you mostly geographic? Is it mostly influenced by the people who live near?
Oh.
I mean, and I didn't want to say exclusively, because the way you were talking about it, you have people who range from
We
other
do.
cities and towns.
We do, and it's really, you know, it's not just word of mouth among the downtown community or the immigrant community. I feel like we take care of the whole town of Rumford down here, you know, and that's actually more of a commentary on how hard it is to find good health care in rural America, not just rural Maine. But
Now
people
that you
come
mention
from
it, you're
quite
right.
far abroad.
Like when I think about a lot of our patients,
Yeah.
they're kind of from the Tree Street area or Lewiston, Auburn, but then we do have quite a few from Rumford area too.
Do, and that's been amazing during COVID. We've been able to use telehealth for other non-pandemic needs. You know, people who have transportation barriers, people who have severe anxiety and have trouble leaving their house. It's awesome to be able to accommodate them with telehealth.
You know, that's been a product of COVID, obviously, and we're going to be talking plenty about that. But telehealth, that's changed the game for us. I mean, that really changed things, right? We didn't have that before COVID. Now
we were not allowed to, really.
No, and it's funny because it's so simple.
So
where you
simple.
don't, you're kind of like, why didn't we do this before? And it's literally, it's phone call appointments where, why didn't we just offer this? Our doctors could just call and have a conversation with someone and meet some of their needs. Not for everything.
Yeah.
No, right.
I just want to say, to get back to like, again, the specialness of like B Street. We have a food pantry. We have a clothing pantry. We have collection of glasses, eyeglasses for people. When I was a brand new nurse at B Street, I'm often the one who gets called up front when we have somebody who shows up on the spot. And I remember this one day clearly, and this really hit home for me about how I work at a special place. We had a guy come in, Rwandan, but spoke Kinyarwandan. And I knew right away, I'm like, okay, this guy's gonna have an interesting story. He comes in, hobbling in, bent over, or like walking at like a 90-degree angle his back. And I'm just like, oh my gosh. And I'm talking to him, we have an interpreter. He's like, my back, my feet, I'm standing all day. I volunteered a kitchen and my back is in severe pain. And I'm just looking at it, I'm just like, he's standing all day. And the first thing I thought of was shoes. And I look, the shoes he was wearing literally looked like pieces of wood strapped to the bottom of his feet. And I'm just like, is that your only pair of shoes? I'm like, do you have any of these? And I kind of kicked my own foot up and showed him sneakers. He's like, and the translator is just like, the patient says he does not have shoes like yours. And I'm just like, oh, that's your problem. One of our secretaries immediately was just like, I can go look and see if we have shoes. And I looked at her, I'm like, you can do that? And she's like, yeah. I'm like, we have a pile? She's like, yeah. I'm like, go. She goes, she comes back, sneakers in her hand, gives it to this dude. Instant relief. I mean, we saw him. This was one of those situations where we're like, do you have a doctor? No, you've got one now. I'm like, we have an appointment at 3:20. Stick around. You have to wait a half hour, but hang out. Put these shoes on. And immediately the guy put the shoes on and he was just like, he's never had a pair of shoes like that in his life. And I remember just like going back to my desk and just being like, oh my God, like we just that was like a game changer for this guy. And we're setting him up for success. And you can't even get that if you go to the emergency room. They don't have shoes for you. I mean, maybe they do, but like, I remember for me, that's when I was like, this place is awesome.
It's the resources that you guys have availability to or can pull from.
We get things donated to us.
We do. I mean, I think it's more just trying to be human, and treat everyone humanly as well as humanly possible. We try. It's not always possible within the confines of the system.
You're right, but I would say when you think about the system, I don't think that they can reach people in the same way we do in general. In that sense, I think the system is limited. They're limited by corporate policy a lot of times where, you can't give that patient a pair of eyeglasses without knowing his certain prescription. What if something happens and we're held liable? Like all these corporate kind of rules and stuff. No, don't get me wrong. We have them, but
risk benefit.
Yeah. Sometimes at the end of the day, it's like, well, this guy is walking into a wall because he needs glasses. This is going to be something that's more or less going to work. And we'll set him up with an eye doctor appointment at the end of the day, or make a referral, and he's on the track to success. But in the meantime, we gave him a pair of bifocals so the guy doesn't walk into the door when he leaves. So I mean, Carolyn knows a lot. Carolyn's been at B Street for going on 8 years.
Going on 10 years.
10 years?
9 years.
So I've been there 3.
2012.
And so Carolyn has seen it since the beginning. So, but for me, I walked into it as like a job. I got there and I'm like, and Karen and I, when I first applied, we met outside at like some touch-a-truck event with our kids.
And I remember being so pissed because we were having issues with management at the time, and they thought Duke was just the greatest thing since sliced bread. And I remember overhearing him at touch-a-truck. You ran into one of your old professors.
Yeah.
Our kids are the same age, so we overlap a lot. And they're like, how do you like it at B Street? That's amazing. And he goes, yeah, it's days. So, I mean, I was working nights, so it's nice to have days. I was like, this guy.
And you know
but
what?
he worked out.
And you know what? I understand that. But I will say I was sold during that interview. And it was like, it took a couple of weeks where I realized, I mean, I understood the mission and what we did at B Street, and I knew it was right up my alley. But at the same time, I just knew that this was a special place and I was perfect for it. And, there was no turning back for me. It really ended up being the best thing. And I was coming from just about the most intense and dangerous type of nursing you could possibly get. And I was doing nights.
St. Mary's.
I'm
sorry, CMMC, were you not?
No, it was St. Mary's.
Oh, it was St. Mary's.
I worked in one of their psych departments. So it was very hard. I actually worked in the behavioral emergency room, which is very, very hard. And so I needed something that was days. I needed something where I wasn't stressed to the absolute limit every single shift. And so when Carolyn caught me, I was like, this was a period of time where I was breathing a big sigh of relief. And I was coming from one extreme to the other. Definitely. So yeah.
Ready for a transition.
Yeah. I was like, at the time I was like pulling my hair out of my head. And for me, it was like, yeah, it's days. Awesome. But it ended up being much, much more than that. And I really cannot picture myself working any other place. And I certainly can't picture myself going back to a hospital. After working at a place like B Street, I could never do any type of nursing other than this.
Yep.
And it would not be anywhere near as rewarding as B Street is. Very rewarding. And
That's what we try to remind our coworkers of that. You know, it's exhausting. And I think especially with COVID, there's a lot of like secondary trauma that our coworkers have. And
oh my gosh, yes.
there's always drama within the office that's really magnified this year when everyone's trying to manage their kids at home, manage their work. There's just so much. But the grass is not greener elsewhere in healthcare in terms of the kind of meaning you actually get out of it and the relationships you can form with families. So
I like to think, and everybody we work with is fantastic. And I honestly feel like to a degree, we all live the mission at B Street. And for all of us, it's a source of pride. And, it kind of completes me. I mean, I feel self-actualized working there. I mean, I'm very happy professionally, and it's very satisfying, and I get to help people because of my job as a registered nurse, but I help people socially, and I'm their friend, and I will be there for them just to talk if they need to talk to someone. And like it's a very special place, and everybody we work with really, I feel, lives that mission to a degree. And very, very proud to be at that place. Really, it's a fantastic office.
Can I bring it towards, you talked about telemedicine.
Yeah.
And my introduction with telemedicine, I come from the cannabis industry more, and I was working in the storefronts. And telemedicine started to poke its head out early to mid 2019. And it was for the ease and the access of getting a patient card for people who wanted to go to medical stores.
And more often than not, it's a nurse practitioner who
right.
doles out those cards.
So for you guys, is it still a nurse practitioner who will receive the call, or what's that process like for telemedicine?
Could be any of the providers.
Could be any.
We have at B Street, we have one physician. We had another physician at our pediatrics office. Whoever it is, and same with the psychiatrists, whoever it is can do a telemedicine visit. Doesn't matter who. Obviously, the nurses, medical assistants, front office, they're taking calls all day long. But when it's a provider, you can actually bill for that service.
What percentage of people would you garner, patients who might come in, has telemedicine helped or started to accommodate in the process? Has it become significant?
Well, we didn't do it before COVID,
Right.
but I would say probably almost every single patient has had a telemedicine visit at some point,
It,
other than children. Children's tough.
Because we have telemedicine, we can see more patients more often, and it's easier because you have somebody who might be homebound, and it's like, well, okay, well, you have like this rash on your hand. Okay, well, go into a well-lit room, and you have a smartphone. Okay, so you're going to get a link, and you're going to get a text, and blah, blah, blah. Make sure in a well-lit room. Carolyn will literally be at her desk with like a webcam, and she's just like sitting there chatting with them, and you got this other person. It looks like they're Skyping, and they're just like, you see them on the computer screen, they're holding up their rash, and Carolyn's asking questions, she's assessing, and like she's treating them. Mm-hmm. So we can see more people, and there's much more flexibility.
We don't use it as much now compared to the beginning of COVID. I'm finding people really want to get back to that in-person,
Experience
touch.
and conversation.
Yeah.
But there's a lot of people who still really love the fact that we can go telehealth if we need to.
So it has worked its way into.
It's not going anywhere, I don't think, is it?
I hope not. I think the one way they might scale it back is they've allowed us during COVID to even do just a phone call. If the patient doesn't have a smartphone, if they don't have Wi-Fi, if the connection's not good, we just do a phone call.
Yeah.
That's where some of the insurance companies really want it to count as a face-to-face visit. Amber, you're going to jump in. I'm ready. Amber's got some hard questions.
Well, I think what we've obviously touched on a lot is like how you connect with your patients and the community around you, right? And I want us to keep in mind that, yeah, Lewiston's full of residents, not residents, immigrants, but they're residents now, you know what I mean? They've been here for like 20 years. They lived here, they live in Lewiston, you know, this is the life, but I guess how do you think that the background impacts your work? You know what I mean? There's definitely a cultural difference, especially with older generations that maybe have immigrated here, not necessarily new ones that were born here or whatever. But yeah, how do you battle that cultural competence, I guess?
Great question. It's
And
not always easy.
That has like a million different answers too.
Yeah. We're really fortunate that a lot of our staff come from the community. So I think that helps. We had a Somali nurse practitioner in the past. We've got Somali front staff, cultural brokers. We have 4 cultural brokers that we use to interpret.
And cultural broker, I think, it's a term we use in our office and at St. Mary's, and it's people from the immigrant community who are liaisons. They're interpreters, cultural interpreters, as well as language interpreters. I mean, they really help us make that connection. So we have a few really, really awesome people, you know, Hassan, Modine, Isa, Najma, and anybody else involved who help us really make a great connection. But Carolyn is very, very close friends and heavily involved with that community also.
Yeah, I mean, I think it's like with any community, the longer you've known someone, the more apt they are to trust what you're saying. I see the same thing in the Somali community that I do with my white patients who are very religious. They are very hesitant to do things that could alter what God has planned for you as your outcome. And so, you know, mammograms, colonoscopies, those kind of things to catch cancer early, many people, regardless of whether they're immigrants or white folks who grew up here, it's kind of like, well, if it ain't broke, don't fix it. You know, that's what a white person may say to me. And the elderly Somali lady may say, well, why would I go looking for a problem if God has a plan for me and I'm going to die of breast cancer? Having a mammogram isn't going to stop his plan. No, but theologically speaking, God gave us the tools, you know, to interfere with things before they can kill you before your time. And so I find that when you really talk to people, they do end up coming around. But it takes time. And time is something that most people can't give in healthcare because you've got a patient scheduled every 15 minutes. Mm-hmm. You can't sit for an hour and talk to an older woman about her beliefs and her life and why it might be hard for her to get a mammogram, show pictures that you really don't have to get fully naked to get a mammogram, all those kind of things. And we don't have time for that because it doesn't make money. So the biggest barrier is really the system, not the patient who may or may not be a person of color. The barrier is the system not allowing us the time to form the relationship.
The system it's not the type of thing that can be changed overnight, but is it like a lot of other industries where it's, you've already had there's a certain amount that's going to be invested in it and you have to work within the confines of.
Yeah, I mean,
is that what it is, really? I mean, for the most part, although you're trying to offer a different type of experience, accommodation or
there are certain things that you do as a provider where there's no relevant billing number for what you do for this patient sometimes. Mm-hmm. Sometimes you're providing them reassurance. Sometimes you're validating their spiritual values. There's some things you can't bill for and some things that take a lot of time that you can't fit into your 20-minute slot to see that patient.
Yeah, I mean, we're graded on, quality measures and those kind of things. So diabetes may not be the person's priority. They may be there for their mental health, but we've still got to check off that we drew blood to check an A1C, grabbed a urine to get a microalb, checked their feet, talked to them about their blood sugars, sent them for a diabetic eye exam. That's not why they came to see their provider, but that's what we have to talk to them about. And I'll leave it to people smarter than me to fix the system. I hope it'll happen at some point in our lifetimes, but I'm not optimistic, unfortunately.
We, the Carolyn especially, we sometimes stretch ourselves thin in our job to try and accommodate and try and help people, because at the end of the day, we just want to help them. But it comes at the cost of, being backed up on our responsibilities, or being backed up on charting and work and whatnot, and taking on too much. And that's where really, as healthcare workers, that's what we have to do, is reel ourselves in, because we would do whatever it takes to help people, but because of the system, we just don't have the means to do that appropriately.
And it's all related to why, your original question, what are we battling with our specific population? We're not battling the patients, we're battling the fact that people of color have much, much worse health outcomes, regardless of income, regardless of education. And it's all related to systemic factors. And COVID has really exacerbated,
oh my gosh,
those disparities in huge ways. And I think Lewiston is a perfect example. I mean, Maine, throughout the pandemic, had the largest racial disparity in the whole country when it came to COVID infections. That is disturbing, and it happens for so many reasons. Our systems are so fragile, and people want to forget that. They want to just put COVID behind them, but when it exposes how fragile a system is, what else in the future is going to cause breakdown in that system that's going to disproportionately affect people of color?
COVID, was a game changer for everybody, everywhere, in every aspect and facet of their life, professionally, socially, interpersonal relationships. This might be a good time to really kind of revisit the whole COVID experience. And we have a couple people from two sides of the same COVID coin. We have healthcare workers looking from inside the system out, and then we have some people here like you guys who are patients of the system, kind of looking in. And that was a difficult thing to really kind of make transparent for everyone. So if I could, I would like to bring ourselves back.
Yeah, let's go back to like March and April of 2020.
Year and a half ago.
COVID-19 hits the world, and we, even though it might not have regionally hit full bore in every part of America or the world, we still had to sort of figure out, we still had to put pieces together.
So for me,
what was that like?
A little interesting story about the beginning of COVID for me is my sister-in-law lives in Europe, and I remember my wife and I talking to her, and this was January 2020, and she was scared. She's like, look at Italy. Look at what's happening there. It's going to hit everywhere. And we knew about COVID in Italy, but it wasn't something that was being talked about that much on the news. And my wife and I are talking to her sister, and we were just kind of not taking her seriously. And we're like, no, it's not going to come here. We're going to be fine. And then like later that night, we were just both kind of sitting there, and like, I think we both kind of admitted to each other, it's like, well, what if it does come here? And then we didn't really say much. And then it really was not long after that where it hit the fan for us. So that for me was the first bit of COVID that really went on my radar, was hearing my sister-in-law from Europe being scared and warning us about it. And I waved it off, but then even in that same day, I kind of admitted to myself that maybe there's something there.
Yeah, I mean, it really is, I'm a little bit, it's very jarring to sort of think back on it, because Duke and I, even though we see each other every day, we actually haven't had a minute to even reflect.
We do it in short bursts of maybe 2 to 5 minutes where we sit and we hobnob in
with
between.
A lot of swearing.
Yeah.
Not appropriate for the pod. But we really haven't, and I think this is true of all healthcare workers, they have not processed what just happened to them. And I don't want to diminish.
Because it doesn't feel like it's done yet. And it feels like there's more to come almost.
There is definitely more to come. And there's no opportunity in our lives to stop and reflect and process. So we don't even know yet psychologically how this has affected us. I don't want to take away from the more severe kind of PTSD that bedside nurses are going to have. You know, that's equivalent to being in a war, and what nurses in the ICU went through, including people in our own community. It's very, very upsetting to think about. What's different with us is it's a different sort of trauma, I think, because people who we've taken care of for many years as patients who have died from COVID or who have had really negative outcomes, we're still going to take care of their families and their communities going forward. We knew them before. We had these long-standing social relationships with them. So not that you don't feel a loss as a nurse at the bedside taking care of a patient, but it is really different to lose somebody who was part of your community, who was a relative of someone you work with or whose kids you're going to continue to take care of. And I think it's going to be interesting how it plays out.
More to come.
More to come.
Maybe later we should get into that part of it.
Yeah,
because I wanted to talk more about that initial, how you were practicing, how your day to day or week to week or month to month.
No. We definitely, there are milestones of things that happened in our office that in our experience kind of changed the game. So let me just say, like, going through nursing and medical school, they always warned us about a pandemic coming. Mm-hmm. Whether it was the avian flu, SARS,
H1N1 when we were in school.
Mm-hmm. They talked about these things like the big one's coming. And you guys, as nurses and healthcare providers, will be heavily involved. You're going to be around these people. You're going to get sick. As a nurse, it's like you could get this disease, but if you're up and you're walking, you might be at the point where you have to be in the hospital caring for patients, even if you're sick, because you are a healthcare worker. So this was something that was always drilled into our heads. And I think everybody who went through nursing or medical school was aware of this, knew that this type of thing could come. They talked about it. And I think all of us knew that it's possible, and we knew what we had to do as healthcare workers if this were to happen. And that essentially is you're involved through thick and thin. Even if you get sick, you're going to have to be on your feet. You're going to have to perform. So we basically, I know for me personally, I was prepared to just be like, well, we're rolling for it, or we're rolling with it. And I got to do what I got to do as a nurse.
I think we were prepared in a sense, but we were also not prepared for how much we were going to be let down by the institutions and even by the general public who should be protecting us. So there's a lot of bitterness that I think we've developed. Personally, I've had a hard time even talking to people outside of healthcare, other than my husband, because he's been right there with me. But, nobody talked to us about, you should expect there will be a shortage of PPE when that time comes. And I mean, so your original question, back to the very first week, I remember March 9th, early Monday morning, I was walking to work and it was like this huge full moon. And, nurses and full moons, we're very in tune with the moon. And
definitely
there's
see
something to be said. Cycle, is it not?
It changes behavior.
It really does.
Oh,
it changes
for
behavior,
sure.
human behavior.
Behaviors, premature births. I sound like a kook, but we have very firm data as nurses that the full moon is valid. And both of my NP coworkers were away that week. My office mate was in Northern Maine. Our other NP was in New Zealand.
On vacation
on his honeymoon.
Oh, wow.
And I remember thinking, it's a full moon. This Friday is Friday the 13th. Both my coworkers are out. This is going to suck. And little did I realize Friday the 13th was my kid's last day in school. Mm-hmm. And my patient's last day in school. And that's a whole nother conversation, is these kids being out of school, which I think is the biggest tragedy, for me personally, professionally, everything. Our kids are the same ages. So mine are 6 and 7, Duke's are 7 and 8. And thankfully, because of our resources, our families have been able to keep our kids happy and healthy. And most families have not been able to do that. So that's been one of the huge COVID tragedies. But that Friday, we realized we're not going to have PPE for what we need to do. So yes, as nurses, we've always been prepared for a global pandemic. But that Monday, Duke and I got our N95s, put them in a paper bag, and we used the same N95 until it broke. Months.
Until you literally couldn't wear it because
it
there was a hole worn in
dirty.
it.
There's a hole worn in it. We couldn't get more. We
gowns?
We now have more PPE than we know what to do with because all the orders are finally in. But we reused PPE for a year. And we were using gowns that definitely didn't fit you.
Right. Yeah.
You see the workers in China in full hazmat suits taking care of their patients, and we've got a little paper thin gown and an N95 that's been worn for 2 months, and it's not acceptable to expect healthcare workers to continue to show up and do their jobs under those conditions.
Counted down to nothing, and he sailed into the blue. Left behind a worried world and everything he knew. Far from the war below, on a sea tranquility, 250,000 miles from home, he fell down on his knees. Oh, how could he know he'd be standing alone, as far as a man can come from home. Where can you go when your dreams have all flown? As far as a man can come from home. Back on the green, green grass, he buries deep inside the color of the ocean's blue against the endless night. And though you offer comfort, it's too far away to hear. It's falling in a big black hole that's deeper every year. How could he know he'd be standing alone, as far as a man can come from home? And where can you go when your dreams have all flown? As far as a man can come from home. The years drift by like vapor trails, fading into blue, counting down to nothing, drinking beer at the barbecue. He goes to watch his grandson playing baseball in the park. The ball soars up above the lights, disappears in the dark. Oh, how could he know he'd be standing alone, as far as a man can come from home? as far as a man can come from home. From home.
And, Carolyn was telling her story about more or less when it all became real for you, right? It was that day where you came in, it was Friday the 13th. It was right around that same time where I think the reality hit for everybody in the office. Email that morning, St. Mary's administration, a provider in the system, was the first person to get COVID. This was the beginning, okay? And I remember reading that email and just being like, gotta be an ED provider, definitely. And we're like, must be. And this was like
What's an ED provider?
Emergency department provider, emergency room doctor.
Okay.
Not erectile dysfunction.
Right.
Bad joke.
Although that is also what it means.
Another medical abbreviation.
So we
part two.
we get this email that kind of tells us the first person affiliated with St. Mary's has COVID. And I think all of us were like, well, must be an emergency room
That was the first
doctor.
one in Maine too, right?
Yes. Now, and so this happened in the morning. That same day, St. Mary's had just set up their first official clinic, a place to send people who are speculated to have COVID. We didn't have anything like that. Like we would if we had somebody, we would send them to the emergency room. We'd call the emergency room and to give them a heads up. So this is the first day where St. Mary's had like a clinic set up, and I believe it was at the Armory or something.
First at the Armory outdoors, later at Mollison Way, but it only ran for a short time, and then we sort of resumed our own kind of work around at B Street for our own patients.
And we'll, we're going to get to that.
How come how come it was only made available for a short period of time?
Not sustainable. I mean, financially, these providers need to be back in their home offices taking care of their patients, and eventually they reopened Mollison Way as a regular practice.
Did they have proper PPE at these
At the beginning, the hospitals, I'd say, had enough to make it, but nobody had a surplus.
No,
Yeah.
and they were reusing from day one.
They were.
And so we have this day. We get the email in the morning. It's the first provider in the St. Mary's system with COVID, first person in the state, and we had just opened up this clinic. So the day is full. Everybody's on edge. We're all on edge because things are happening, and I think we had all kind of accepted, like, all right, it's taking off. COVID is here. We have a huddle, which is, a department meeting. And we have it usually in the mornings, and they're sporadic. This was 2:30 in the afternoon.
They're every day. They're every day. If any
Right.
else administration is
Yes.
is listening, we
Yeah,
do have
no,
a huddle every day.
No, they're every morning.
Every morning, right on the dot.
So it's like, it's 2:30 in the afternoon, and there's a huddle. We're like, okay. And for me, it wasn't even, I was just like, okay, I'm busy. I'm like, okay, huddle, what is it? I got my notebook. We're sitting there. There was a provider who tested positive for COVID-19. And as soon as they started talking about it, I'm like, no, it can't be. It was one of the providers at B Street.
Oh wow.
It was.
Yep.
It was one of the providers at B Street.
Who we had all had contact with.
And we have an office of maybe between 10 and 16 people there most days. I mean, it's
Like
not a lot.
25 employees, but they rotate through.
Yeah, exactly. And so they tell us that it's one of our providers. 1 week before, we had a potluck in our office, and he was walking around talking about how sick he felt.
Oh no.
And we're all just like, the color drained out of everybody's faces. We're all just like, we hear this, and you could cut the tension with a knife. You could hear a pin drop. It was just like so surreal. It's like, no. And he was in the hospital already.
Yep. And he won't mind us sharing this. I mean, he was very, very sick. Healthy guy. He thought he was going to die.
It's awful.
And so we're like,
He was in the ICU at Maiden Med.
we're all just kind of like, oh my God, this is so surreal. They kind of tell us this. All of a sudden, everybody's kind of going their different ways, and it's like everybody's really just like, oh my God, I feel warm. I feel warm. Like all of a sudden, people are scrambling around.
Yeah, no, I remember having that feeling where all of a sudden I thought I had exposure to somebody, and I felt like it was affecting me. And so the mind is very powerful like that.
You're right. You're right. And like this was reactive, but there was some validity to it.
Oh yeah, 100%.
All of a sudden, there's people not in our office anymore. 4 people left right after that huddle we had. I all of a sudden developed chest pain that day. I had chest pain for 2 weeks, and I was talking to the providers about it. And I'm like, listen, I've never had cardiac problems. I'm not having any shortness of breath. I'm not dizzy, but I have this discomfort in my chest.
Was it the anxiety
It was the anxiety of the situation. I had that 2 weeks. And that day we had coworkers gone who tested positive. They went and they didn't feel good that day. They left.
And they tested positive.
After we had
After you huddled?
after we huddled, we literally had 2 other people in our office who had COVID.
But you guys didn't get it? You guys didn't contact?
I was tested three times during the COVID pandemic. I never had it.
Same.
But we were
Exposed, definitely.
testing people. We vaccinated people. We were with COVID patients face to face. So
Constantly.
and I think we always wondered. But
If you had it or not.
But we masked up, we put on gowns, we washed our hands, we were conscious of touching our
I
face
was
and our mouth.
I was certain I must have had it, but I give blood every, 2.5 months, and during the pandemic, the Red Cross was testing every blood donation to see if they had antibodies, and then they were using those antibodies to do further research and for
Could the
certain
blood
patients.
still be used?
Yep.
It could,
Not
right?
if you're sick with an active infection.
Okay.
But if you have antibodies, they wanted that blood
Right.
to see what, if it could help people. But every single time I didn't have antibodies until after I got the vaccine, I had antibodies. But it really seems to affect certain people more than others. I think hopefully there'll be more research on that. But we ended up, after this first few weeks, deciding to take on testing operations and sick visits at B Street because it's easier for people. We could do it, more quickly, more flexibly.
And we are in
People had
the
the trust,
center of downtown Lewiston. Like we're a hub.
We set up a testing window, out of one of our exam rooms where
Can I just talk
Yeah.
about the testing window?
Please.
Because this is something that was really special too. We slapped this together. I mean, the materials were donated. The time was donated. Like it was built by volunteers.
it went through a few iterations.
Oh yeah, right.
We tried a few different structures, but it was safest for the patients and for us because they were outdoors.
We literally
it was
set up
very
a station
cold.
outside a window in one of our exam rooms.
And we perfected it multiple times over the course of the year.
Because there was really nothing else.
No.
There was something set up, like each hospital kind of had their spot, but it was so new and the process was not smooth at all. We had to do something to meet the needs of the patients.
But it kept a lot of people out of the ER. We ended up in a partnership with the school system to test teachers, staff, students whenever they needed it, which, was difficult because a lot of times we did not have capacity to do what the schools needed us to do. But thankfully, the administration at all the Lewiston schools and all the school nurses were amazing. And
if you had symptoms, you went to B Street.
yeah, and
If you worked in the school system,
really
you had symptoms.
people forget about school nurses in terms of the pandemic. There's a lot of talk about nurses and ICU nurses and heroes, and
right.
school nurses are really the heroes of this entire situation. I mean, the fact that any kids had any in-person school at all, you can thank a school nurse. They were right on top of it, and they got the worst pushback, anger, emotions about COVID compared to anybody.
From who? From parents?
Yep, parents, teachers, in both directions. There are teachers who didn't want to be in school at all, understandably so. There are teachers who firmly believed that we should be in 5-day-a-week school. And
There were teachers who thought it was all a hoax, like everybody else.
teachers are a cross-section of the population, just like nurses. But every single positive that we got at our ice shack, that's what ended up, our final structure that we built looked like an ice shack. Thanks to a church in Yarmouth. Shout out to Tom and Mark Rainsborough. They built it. They're contractors, construction workers who just did it out of the goodness of their hearts. It was amazing.
That's cool.
Every time there was a positive there and we had to make that call, either that person gave us permission to talk to their school nurse, whether it was a child's family member, staff, we would call the nurse ourselves, or we'd say, hey, do you want us to call your school nurse, or do you want to? They'd say, oh, I'll call her, I'll text her right now, whatever. And from there, the chain of events that those school nurses had to deal with is a, political nightmare every time. It affects so much more than just that one person who's positive. And that's true of any community. I mean, when we did a rapid test, before we had those Binax cards, we had a machine. And that machine, if it's negative, it runs for a full 10 minutes. It's a complicated process. Takes about 5 minutes to set it all up, do the swab. If it's negative, it'll run the whole 10 minutes. It'll bing at the end that it's negative. When it's positive, it turns right away. So you put it in, you're chit-chatting with the patient. Hey, I'm sure you don't have it, but it's good to make sure. Bing!
And you're literally, you're kind of like at the computer doing anything. You're just like,
I hear that sound
like, oh,
actually
no.
often,
Yeah.
even though we're no longer using the machine.
you just know if it goes off in less than 10 minutes, you're like, oh man. And you go, and every positive, everyone is always like, oh my God. It was always the same, like, I can't believe it.
But the patients could believe it, and they'd say, yeah, I knew it, and now I got to do this, this, and this. How am I going to work? How am I going to pay rent? I've got to bring my kids here, there, and everywhere. I can't quarantine from my kids. I've got a baby at home. I've got this, I've got that. And just those things that we can't fix. We give you the result, and, eventually there were more resources through DHS. The Ramada set up a quarantine shelter, but if you're a mom, you're not going to leave your kids and go stay in the Ramada. I wouldn't have done that.
Wasn't very realistic.
It wasn't, but it was an option, and we did utilize it. But, when we did the actual, there was only certain situations where we could use the rapid testing. Other situations, we had to send it out to the lab.
Yeah.
Those results would usually come back late in the evening. And if it was a person who was positive, who I knew it would affect their very next decision, going to work, going to school, their kids going to school, we'd call them at night. And, 10, 11 at night, the person would answer on the first ring. And whether it was like a high school principal or, a family trying to enter a homeless shelter, you just can hear on the other end of the line, like, what am I going to do now? And that's the part of COVID that's so emotionally difficult to kind of like understand. You think about people dying and people getting severely sick, but you don't realize how much it affected people's incomes and people's ability to keep their kids okay. Yeah. And those are the kind of disruptions that are going to affect kids for a very, very long time.
One kid is exposed, has to get tested, automatically has to be out of school. Family members can't go to work, have to stay home.
That child's classmates, immediate
classmates. Have to get called, have to get tested. You get a positive in the family, everybody living in the household has to stay home, and then some. Even after that one person's out of quarantine, you're still in quarantine for, it could even be a couple weeks.
It could be 20 days because you've got to serve, if you test negative, but your sibling is positive, you've got to be home for 10 days. That's the incubation period of your sibling's positive. Your sibling is still contagious on that 10th day. You could hypothetically get COVID on that very 10th day, and that restarts a new set of 10 days for your incubation period. So 20 days multiple times throughout the year for a kid in a big family, it's devastating. And this is where politically COVID is so interesting because I'm, as everybody knows, very progressive, diehard liberal. But I found myself very much aligned with more conservative people on this issue because kids being out of school is a public health crisis. Schools should be 5 days a week no matter what. We have a right to public education in this country. And these children having to go to school remotely, teachers tried their best, but that doesn't count. And, I've gotten in brawls with my friends who are teachers, some of whom are maybe no longer my friends. You've got a job to do and you've got to show up and do that job. It's not a popular thing to say, but their schools should have never been shut down unless they did not have enough staff to function, which this spring did happen in Lewiston due to a shortage of bus drivers. But we've had kids gain 100 pounds in 16 months. Wow. 7, 8-year-olds.
Wow. You call it
We've had more
COVID-15.
Wow.
COVID-50, more like.
Yeah.
We've had kids with no history of mental health issues, very high achieving athletes who've developed severe mental health issues,
Yes.
child abuse across demographics, across income levels, way on the rise.
And if you had mental health issues previously, they were cranked to 11.
Right. And so, we also had a huge increase in diabetes, type 1 and type 2. I had more new kids with diabetes in 1 year than I've had in 9 years.
How would diabetes have been brought on by that?
Well,
Dietary?
it's so fascinating because
Lack of activity.
I was
Yeah.
I was blown away by the number of new kids with type 1 diabetes that we were seeing. And
type 1?
Type 1. We've had 14 new cases of type 1 diabetes this year in adults and children, after maybe having 3 in 9 years. And I've talked to the pediatric endocrinologist at Barbara Bush about this, and apparently they're seeing this nationally. It's possibly just like type 1 in kids can be brought out by any virus. Kids who may have had an asymptomatic case of COVID who are genetically prone to type 1 diabetes, that gene ended up being expressed.
It like kickstarted it.
Right. Not to mention just the stress of the pandemic, bringing it out, the COVID lifestyle, even though it's type 1, being home, being sedentary, not eating well, losing your sports. There's things we still don't understand about it, but I'm rambling. But, back to the school thing, the school nurses were put in a position where they were literally the center of the community. Every decision, every guideline.
Well, it was impacting everybody.
Yes.
I shouldn't say everybody, but it was impacting a vast majority of the population.
And what really put people at odds with one another was just a lack of understanding across the board. And that's a lack of understanding about COVID. It's a lack of understanding about how to go forward and cope with COVID. It's, what resources do you have? And
Well, we talked about that too. I mean, there was this idea where, again, it was a guessing game in the sense of what are the symptoms? How are we supposed to react? Like you guys talked about early exposure. Did everybody go into quarantine that was working there for that 20-day period?
Nope. The day
because there was no way people who were accessing it were going to be able to.
Like I said,
you need to be able to survive or offer something.
There would have been a change at some point. If COVID had gotten so bad that everyone was getting it and the hospitals were totally overrun, if I was a nurse and I had COVID, but if my symptoms weren't bad, I would be expected to go to work and work with COVID patients, even though I haven't.
Yep.
Even if I'm sick.
Right.
If I'm not having shortness of breath or chest pain, I'm just having like the respiratory issues, I can work. We would have been expected to work with COVID if it got that bad.
Potentially continuing to spread, be a conduit to spread. Would I be wrong in saying
Hospitals.
Administrators would say no, but
what's that?
hospital administrators would say no.
How come? Because of the PPE?
I'll give you an example. All of our patients, we have a lot of patients who are CNAs at Clover and at Marshwood and at these kind of places that have outbreaks. If you're a CNA with mild symptoms and you test positive, but there's a severe staff shortage, you will only work with the COVID positive patients.
Right. Gotcha.
So technically, you're not having contact with anyone who's negative because there's so many clients there or residents there who are positive. But you're driving to work. You're stopping at the gas station. You're interacting with food service people. So once again, you're understaffed, you're underpaid for what you're expected to do. I wrote long letters for my patients who are CNAs who are expected to continue to go to work that they were sick. Yeah, they're not in the hospital, but they're too sick to work. They need to be home to rest and recuperate. And a lot of them ended up just not going back to work.
A lot of them did.
Yeah.
We underwent, or maybe
Well,
more
not
so-
going back to work at that job. Eventually, they went back to work.
More so, I want to say that I noticed it in Europe that there was this a lockdown type of situation where people weren't interacting, weren't going places. And I can't recall. I think every country would have had various 2 weeks, a month, or 3 weeks. We never really underwent that period of time. We did the 2 weeks to slow the curve.
In March.
I figured that was more of as much as in hindsight looking at it, at the moment, I thought it was about slowing the curve, and it still potentially was, but it was also more about gathering, taking our breath, a deep breath, and figuring out directions. Because you talked about bees, you talked about where you are, and that you were now sort of taking control of a situation where you were hoping from advisement from above, and yet it wasn't necessarily, that wasn't how you were getting information, but not decision making. You still had to do it on the fly, did you not?
We did. And thankfully, we have a great administrator at CCS who was right on the ground with us. We also had great relationships with the CDC, partially because the rates in Lewiston were so bad and the racial disparity was so big. They were very supportive of us. That's how we got the initial rapid testing machine, was the CDC gave it to us. So,
And not a lot of other facilities had a rapid. We were one of the only ones.
and
in the
ironically,
state.
you know who used the rapid the most when we first got it was hockey moms over the summer of 2020. We had, if there's a hockey mom in Lewiston, you can guarantee they probably got a rapid test at B Street. Because once they figured out that we had it, this was before rapid testing was widely available. Travel hockey was back summer 2020, and families were traveling back and forth to Massachusetts, and every time they did, they had to get tested. And I appreciate them getting tested. But it's ironic that a service that was meant for the most vulnerable actually was
Served
such
the
a
privileged.
superior service that the privileged utilized it too, which is fine. We then ended up shutting off utilizing it for those kind of reasons once the cases were back to the point that we needed to prioritize people who were symptomatic, teachers in the schools, obviously, school staff, students, those kind of things. So.
I think one of the biggest things we've talked about, not even just at B Street, but in our community and throughout the world, is adapting. And how do we adapt with this new pandemic? With we don't have all the information we need, and we have to figure out what to do.
Well, when you talk about adapting, and this is going to be a hard truth for some people, I don't know about you, but the whole period of time when we were really practicing the isolating, the washing of hands, and the wearing of masks, we didn't get colds like we normally did in my family. People were less sick. The reality is all those interventions that we use to prevent getting COVID would help you stay healthy. To be quite honest, but pre-COVID, I remember going to my son's wrestling tournament and going into a gym, and I'd never been to a wrestling tournament, shoulder to shoulder, packed with people, just steam from human body and breath. Like you just felt like you were in a sauna. And I remember thinking then, I'm like, this is gross. That's a breeding ground for COVID.
All right.
Going forward,
Well, for any virus, right?
yeah, oh, definitely.
Right.
Going forward, people would probably be well served if they, during cough and cold and flu season, if you're going to a public place, you would probably be best served if you wore that mask. Kept that hand sanitizer in your vehicle for when you get out of the grocery store. I think that's a big thing we've learned and something that we've adapted with, that these precautions would really work nicely for us going forward to prevent getting sick. And I think people would be very smart to continue doing this to a degree. You don't have to do it all the time, but if you're going to a Celtics game in, late January and it's cough and cold season, probably wouldn't be a bad idea to keep a mask on while you're at the event.
Absolutely. And I think we see
The
kids.
mask, the common mask that people are wearing, even if
anything.
it's a kerchief, you
Yeah,
think
it's
that
a barrier.
has enough. I'll play the devil's advocate in this situation. You think that's really effective enough on the everyday, as opposed to if they're just going to social distance?
Well, a lot of,
do.
yeah, definitely.
And I think
Because I felt resistance to it.
definitely.
from
I mean,
time to time,
the
and I know a lot of
transmission.
people.
Yeah, I mean, it's tough. It's an adjustment, but we see kids, even the most behavioral sensory kids who struggle to adapt to other things, kids have no problem wearing masks. My kids go to Connors. They didn't have a problem all year long with kids wearing masks.
It's not a thing for them.
They adapted, they wore the mask, and kids were not sick this year. I had kids with asthma who usually have, multiple exacerbations a year, didn't have a single problem, didn't need to use their nebulizer machine once. Kids who usually get 3 ear infections a year didn't get ear infections. Transmission of COVID within schools because of mask wearing, predominantly, because how much can you really social distance kids, was very low. It was very low transmission within schools. There were cases in schools, and there were schools that were designated an outbreak site because they had multiple cases. But you didn't see whole classrooms of kids where every single kid popped up positive.
Counter that a little bit, though, is that also the data on children and people of a certain age, could that also be a factor in that as well?
For sure. I mean, kids, generally speaking,
They had this sort of resistance to it in general,
yeah,
correct?
and they don't get as sick and they're not as contagious. So going back to our ice shack outdoor testing, we'd test a family, let's say there's 6 kids very crowded living situation, one kid might be positive out of 6. The other 5 are not. And if that kid has mild symptoms, they tend not to be as contagious, even if they're sleeping in the same bedroom. But go ahead.
I was just going to say, you could have somebody living in a home who has COVID. They could be living in a home with multiple other people, and they're the only ones who end up getting it.
Yeah.
And there's not enough data, not enough understanding yet.
No.
Very
as to why
interesting
that's
to think
happening.
about. And
Or how they can happen.
yeah.
Am
And
I right in T cells? Is that what I've heard a reference to before? Have you heard of? Am I right? Is it called T cells?
I mean, that's what mediates immunity. But
The
why?
the helper T cells, the ones that come to the rescue and fight off.
I mean, this could obviously be something that's in our chromosomes that could be the resistance factor to it. Is that possible?
Could
It
be.
is,
It could
for
be
sure.
genetic.
Yeah.
Could be genetic. Which
and
you
yet
could also
within
explain
families,
why
yeah,
others are more susceptible to.
Yes.
Outside of, but the more popular belief, or not the more popular belief, but the science has proven, if you're immune deficient or if you are susceptible, then you are at greater risk.
Right. And even people who are very healthy immune systems and have a mild case of COVID can end up with this long COVID, which is almost more devastating than having a short, severe, acute case of COVID where you're hospitalized, you recovered, and you do great.
Yeah.
And we've had coworkers who've had long COVID, and it's quite debilitating. And it's an invisible disease, but these aren't people who are whining, who are just saying that they're depressed or they're fatigued. These are truly patients and coworkers who before never had any complaints of chronic pain or chronic fatigue, mood issues, and after COVID are struggling severely. And that's a whole nother reason to vaccinate. It's not just about deaths and hospitalizations. It's about preventing long COVID. And because kids can't articulate as well how they're feeling, I do think that there are a lot of kids, especially teenagers, who've ended up with long COVID, and there's not good data on that.
And when we talk long COVID, we're talking about lasting effects to the pulmonary system, the neurological system, the circulatory system. I mean, there's things that people their bodies have been ravaged that last much longer than just a short stay of the illness itself.
It's not just a respiratory attack.
Oh, it affects your body in a lot of ways. You know what? Just about any symptom under the sun seems like it could be COVID. People want to say
that's also part of what leads people to not believe so much. For those who are vaccine hesitant,
You're right.
Well, everything could be explained to be COVID related.
right.
So why am I to believe? How do you engage in that, or how are you able to?
We explain to them what the most common symptoms are.
Yeah.
And, the ones that you need to be the most careful with. I mean, it travels through droplet transmission. So, I mean, if you're coughing, if you have a sore throat, if you're sneezing, you got to be tested. We had a patient who could not stop hiccuping for days. Could you imagine? It was COVID.
Positive.
He couldn't stop hiccuping for days. And I don't remember how long it was in the end, but it was, a week or
Weeks.
more.
Yeah.
Weeks.
Oh my God.
And that
It
was
was driving
COVID.
him nuts.
Could you
That
imagine
have
not being
been,
able to stop?
Overnight, everything.
That sucks.
Yeah.
That's awful.
The telltale symptom is lack of taste or smell. Definitely it's the telltale one. That's the one where it's like, oh, okay, that's real.
And I want to touch back on Amber's question about
Sure.
adapting. Adapting to masks, adapting to hand washing, that's all positive. But I'm in awe of humans' ability to adapt and accept deaths as a necessary cost of freedom. So we even got to the point in our office, so-and-so died of COVID. Well, that's to be expected. Is it though? Why have we just accommodated that hearing about deaths and having sort of the frail or the sick die of COVID is expected, and we just move right on? And
It was preventable. I mean,
Of
it's
course.
preventable. It's not unnecessary.
I think I felt that most profoundly during April and May. We had by far the worst cases in April and May.
Lewiston had the third highest COVID rate in the country.
And that was straight cases. That was not, percent positive or something that could be explained by population. That wasn't a per capita calculation. That was straight cases.
Of new cases on the
So
rise.
only Flint, Michigan, and one other city in Michigan was ahead of the LA metro area in terms of straight cases. April 8th, the New York Times listed us as having one of the sharpest increases of any metro area in the country. By the end of April, we were the third highest in the country in terms of straight cases per day. But in April and May, everybody was sick of COVID. Nobody cared.
We were all vaccinated.
People in wealthy communities, Yarmouth, Falmouth, Cumberland, they weren't seeing cases. They didn't care.
2021 or 2020?
2021.
Oh, okay.
2021.
Yeah.
This is
Few
2 months
months
ago.
ago.
This is 2 months ago.
I thought
So
you were referring to 2020.
no.
That was a
So
different.
That was a different spike.
ballgame.
That was the first wave. Then we had kind of the Thanksgiving to February wave. Then, April and May was devastating. We had people in their 20s, 30s, 40s being life flighted to Maine Med. We had our highest number of deaths during that time. We had a 22% positive rate at our ice shack, our testing shack at B Street. To have control over the spread of pandemic, the goal is less than 1%. We consistently had a high percent positive rate.
We were testing like all day long too.
All day long.
was
We had to
full.
turn people away. We'd have days where we'd test 9 people in a row from 9 different households. Every single one was positive. And so, yet during that time, April, May, a couple months ago, 2021, people had moved on. Like if you had the means to get the vaccine, you'd already gotten it. You were traveling, you were going skiing, you were living your life. So you had this complete apathy because people had just adapted to the fact that the poor, the sick, people who work in factories, people who live in crowded housing were going to get sick and die. And everybody seemed fine with it. And so that to me was the most psychologically difficult time of the whole pandemic because we were all exhausted from the year and it was only getting worse.
And we could see how people were more relaxed, but we knew that it was really just the worst it was getting.
Yeah. But
It's like we're not out of the woods.
How did it change? Or how come the numbers have come down? Or have
weather.
they? Have they?
They have. Oh yeah. We haven't had a positive at B Street in 4 weeks.
Wow, congrats.
Yeah.
That's exciting.
Yeah. But I mean, it's nowhere now, but that doesn't mean it's not coming back.
This is the Dirty Lou Podcast.
There's a place I go that reminds me of all the things we used to do, where I carved out our names in a special place as a gift from me to you. Ooh, that's where I remember you. Ooh, that's where I remember you. Not a day goes by that I don't think of the time I spent with you. Until I see you again, I will never forget our secret rendezvous. Ooh, that's where I remember you. Ooh, that's where I remember you. At the house behind the neighbors where we used to all hang out. Abandoned yet a time between 10 and 2, where I carve out our names in a special place as a gift from me to you. Ooh, that's where I remember 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 you. I can't describe. That's where I remember you. Feelings inside. That's where I remember you. That's where I remember you. That's where I remember you.
I've gotten sick at every year from September to May. I cough. You remember when you used to work with me. I cough constantly. I don't sleep. I usually lose like 20 pounds a winter because I cough so much. I've seen pulmonologists. I've had all this workup. They think I have like this adult onset cough variant asthma. This year, I didn't get sick once. Yeah. So I'm going to be wearing a mask every year from October to May because this is the healthiest I've ever been.
And like what I ask people too, and yes, it spreads by droplets. Some of them can be minuscule. A mask may not catch it. But let me ask you this. Would you prefer, I get face to face with you, would you prefer me to cough in your face with or without a mask on?
Definitely without.
I know that sounds pretty wild,
kidding.
but people who kind of question that, it's like, well, are masks effective? Okay, well, let me stand face to face with you and I'll cough right in your face. Do you want me to do that
Disgusting.
with a mask on or with a mask off?
And that's called personal consideration of other people.
Yes.
A lot of people don't have that.
It's tough.
Okay, all right.
So
We live?
Okay, yep. I'm gonna clap. 3, 2. All right, so we're back. We lost a member. Carrie had to go to a birthday party, but let's just pick up where we were. Let's talk about vaccines. What is
Amber hitting with the meat.
hard question? How do you feel about them?
For me personally, I didn't feel that strongly about them until I entered the healthcare field. I mean, I got them as a kid growing up, the recommended ones. I never used to get the flu vaccine, but once you start working in healthcare, you either get the vaccine or you have to wear a mask. And this was before the COVID mask situation. So even then, people were more sensitive about having to wear masks. So I was like, whatever, I'll get flu vaccine. I don't want to wear a mask with every patient interaction in my job. So I got it. 1 year, I got the flu vaccine. I'll tell you my own little story. It's interesting. I got the flu vaccine 1 year, beginning of a 12-hour shift. Got it in this shoulder. Had muscle soreness at the beginning of the shift, getting the vaccine, whatever. By the end of my 12-hour shift, this pain had radiated up into the base of my neck, and I just felt super sore. End of the 12-hour shift, I couldn't turn my neck or move it to the left or the right because the pain was so severe. I would go to sit down, and I would get to about here, and I'd just be like, ah! And I would just fall into my bed. And I was like this for 3 days.
Wow.
I almost went to the emergency room at one point. I'm like, I got nerve damage. That vaccine killed me. It cleared up and I was fine. That freaked me out. Continued to get flu vaccines though, and I haven't had any kind of reaction since. I had that one reaction where maybe somebody did hit a nerve or something. So that's kind of my experience. But being in healthcare and knowing that I'm going to be exposed to different things, I rest comfortably in the fact knowing that I have developed immunity because of the vaccine. Mm-hmm. So was I hesitant to get the vaccine, especially the new COVID one? Yes and no. Of course I worried about untoward side effects, and I realized that just about anything could happen. But I also knew that I was a nurse, that I signed up for this. I believe in the work that my peers do. When you talk about epidemiologists and scientists and doctors, I believe in them and I trust them. And if I didn't trust them, I really question whether or not I should be involved in the healthcare industry. So when the vaccine was available, I'm relatively young, I'm relatively healthy. If something bad happens, I would prefer this bad thing happen to me than it happening to my mom or my dad or my loved one who's not as healthy, as strong as I am. And if this is experimental, let's say, then so be it. To hell with it. It's experimental with me, and I just hope that I'm helping the greater good and helping society move forward during the worst health problem that's affected everybody in modern history. So for me, I just hope that by getting the vaccine, I'm helping us move towards getting back to normalcy.
Right. And I think it's important to, I think when people think about vaccines, it's definitely like a personal choice and what you want to do with your body. But like you were mentioning, it's also a choice about who you want to protect, your loved ones, the community around you. You know what I mean?
It's a responsibility of protecting the community and the people around you. That's a big part of it.
Definitely. Do you want to add anything or?
Yeah, I mean, we got the vaccine December 17th, which was, pretty early in the process. And let's see, first dose December 17th, second dose January 7th. And at that point, I think it's healthy for people to have some hesitancy. We, on our side of the political spectrum, we shouldn't be shaming people who are a little bit vaccine hesitant. That's understandable. Now, 7 months later, I think we can say there's really no adverse effect that outweighs the benefit of getting the vaccine.
Well, and that's something that needs to be brought to attention is you have risks versus benefits. Are there like some cruddy side effects that could be possible with the vaccine? Yeah.
Yeah, and we shouldn't lie about that. I mean, there are people, as healthcare workers, we shouldn't dance around the fact that some people do get very sick for a day or two, right. And people are laid out, but it's worth it. That's what we need to do to get our way out of this. On the other hand, it's frustrating to hear people talk about the vaccine like it's perfect. You're never promised that a vaccine is perfect. It's a very effective vaccine, but it's not 100%. And we've had coworkers and patients who are fully vaccinated who've gotten COVID. And some people don't want to talk about that because it makes it seem like it's less effective, but it's not. That's a very small number among thousands, but it does happen.
Right. And if you think about it, you get the flu vaccine, you can still get the flu. You know what I mean? It's the same concept.
You can still get it. You can still give it to other people.
Transmit it, yep.
Yeah. And,
you hope for weakened effects of actual COVID. That's what you're hoping for at the end of the day.
Mm-hmm. And the vast majority of people who are hospitalized are not vaccinated. So that's all the proof you need, in my opinion. But we have to really be careful that we allow people the opportunity to change their minds. There are patients who tell me, I would rather die than get the vaccine. And I don't push it at all. I say, okay, well, we do it every Saturday. You're welcome to sign up on a Saturday if you change your mind. Oh, I'd rather go blind. I'd rather die. Okay. Next Saturday, I'll see them show up. And people who you think are so set in their ways that they'll never, ever get vaccinated, they do change their minds. Unfortunately, as a society, we haven't really left the door open for them to change their minds. We've stopped talking about it. We've shut down the mass vaccine sites. Our last first dose clinic at B Street, we had 93 people signed up. Our clinic on the 17th, we've got, I want to say 80 people already signed up, more to come. We shouldn't shame people whose priority in life is not the vaccine. People are busy, people have kids, people can't navigate the online systems necessary to get these shots. There's Definitely. A lot of barriers. Yeah. So we've got to make it easy for them. And the way we rolled it out in this country did not make it easy for people to get the vaccine. We've got a lot of kids who want the vaccine, but their parents really only feel comfortable them getting it at B Street. And we've worked with both mosques. They've vaccinated a lot of kids at the mosque. We've worked with a lot of ethnically based organizations, the mosques, the one on Bartlett Street and Lisbon Street, AK Health, MERS, New Mainers Public Health, Gateway. So the Somali community has done an amazing job of getting people vaccinated, outreach, word of mouth, places where people are comfortable. It's our demographic that needs the work. So you hear a lot of talk about, oh, Lewiston, they've got a lot of people of color, so that's why they're not vaccinated. No, that's not why. They're vaccinated. Lewiston, Androscoggin County was the last county in Maine to have a mass vaccine site, and the rollout was very slow. So instead of blaming people for not being vaccinated, we have to allow them the opportunity to change their minds.
Yeah. And we really can't shame people. You can't really blame anybody for not wanting to go through with that. But you also can't allow people to misinterpret the truth and kind of put in place a lot of wild conspiracy theories about everything that surrounds that, when at the end of the day, it's something that's just being developed as we go. It was because we are in an emergency situation, and it's maybe not going to be perfect, and maybe they don't have all the answers and stuff, but really it's the only way to kind of get out of this and go back to normal.
And I think something that kind of goes hand in hand with that is this this new Delta variant that's been spreading around. I mean, Maine, we're pretty lucky we're vaccinated all right, and it's not as popular here, but in places like LA County or like, what is it? There's another country, I can't think of it, but it's hard. They're like going back to like having to wear masks inside and
India,
quarantine
South
and
Africa.
stuff. Yeah, exactly.
Yep.
So do you think we should be hunkering down and being ready for that, or
Be ready for it mentally. Be aware. Just be aware that are we improving the situation? Is the situation improved? Yeah. Is it done?
No way.
far from done?
Far from done. And every variant that we've seen, anecdotally here, I'm not an epidemiologist, so I don't want to speak too firmly on it, but the UK variant, the B117, was mostly responsible for the huge increases in hospitalization in April and May 2021 here in Lewiston among younger people. And any variant, whether it's Delta or the B117 or something new, which I guarantee we'll see that too, it's going to find opportunity, and it's going to find those opportunity in non-vaccinated people. The more non-vaccinated people become sick, the more of a chance that vaccinated people are going to become sick too. So if you're resting on your laurels because you live in a community where you can be smug and say, well, I'm not worried about my kid going back to Yarmouth High School or whatever because everyone there is vaccinated, 99% of the people I know are vaccinated, you're still not going to be immune from the effects in society. I think those of us who live in Lewiston are much more attuned to it because we know what it can do, because we've seen how those disparities play out in our community, because we do have a different community than other places in Maine. And when people say, oh, well, Maine's doing great with the vaccinations, we have an older population, so it makes sense that we were a little bit ahead of the rest of the country because older people got vaccinated first. But it's not over. And I don't want to fearmonger either about the Delta variant, but I think we'll just have to wait and see. Verdict is out.
The second and third week of August, I'm going to Europe, and I'm fully aware that I can't get complacent, and that while we're traveling, especially through airports in different countries, we're going to continue, me, my wife, my kids, we're going to wear masks. We're going to be trying to social distance from people. We're going to be hand washing. I'm fully aware that I'm going to be traveling at a time where there's increased risk.
Yeah.
I'm fully vaccinated, but I'm also just aware that I could
Still get it?
I
Still
could get this and I
transmit?
can transmit it.
Mm-hmm.
We haven't seen my in-laws for 2 years. It's like, and their health isn't getting that really much better. So I'm aware that right now is probably not the best time to travel and do all that stuff, but we're going to do it. And we're just going to do it the smartest and safest way we possibly can,
And I think, there's, back to the vaccines, there probably are people who are never going to change their minds.
Right.
I think there's a lot of talk about different groups and why they're vaccine hesitant. I'll speak to nurses because that's my demographic. Many nurses are distrustful of the vaccine, and it's disturbing because we're a very important group that needs to be vaccinated. But at the same time, we have to allow ourselves to see this issue through the eyes of people who are not just vaccine hesitant, but vehemently anti-vax. We have to understand why they are that way. And it's because of distrust in our institutions. So nurses who've spent their careers being understaffed, underpaid, overworked, being taken advantage of by these institutions that are supposed to protect society. They're not going to trust that institution when they tell them to get vaccinated. Give me a break. They know they're doing it just for staffing and financial reasons. And St. Mary's and CMMC are the least vaccinated hospitals in the state. I don't know if I have that statistic right. I'd have to go check. But Central Maine has a very low rate of vaccinations of healthcare workers. People don't trust the institutions that exploit them. So it's not necessarily a conspiracy theory for nurses, which is a group that cuts across political, racial, class lines, to be suspicious of the same institutions that haven't been,
Supporting
necessarily
The
supporting them.
institutions that will call you after you've worked a 6-day stretch and beg you to come in
Right.
and pressure you to come in and work because they need the staffing, who pressure you to come in and work in unsafe environments because there are patients there that need care and there's not enough. It's a complicated situation, but it really all does make a lot of sense.
It does. And, I have a friend who I went to college with. She's a doctor in Trinidad now. She's from Trinidad. And she posted a poll on her Instagram, why do people feel that the vast majority of doctors in Trinidad are vaccinated and the vast majority of nurses are not? It's probably many other reasons in their country and their cultural context, but I think we see the same thing here. We see doctors who trust the system and we see nurses who don't. And how are we going to reach those people? We have to leave the door open for them to change their minds. And we've had coworkers who've changed their minds, but it's tough.
It is tough.
One thing I really would like to touch upon is this whole conversation we've had has been from a healthcare-based perspective. And I know that people who work in the healthcare industry during this whole COVID pandemic, we've probably come off as preachy, know-it-alls, butt kissers, goody two-shoes, like, yeah, you want us to do all this stuff, but look how it's screwing up my life. And I just want to acknowledge for all the people whose lives were totally disrupted and turned upside down by COVID. And I just want to acknowledge that what the healthcare industry asks for you to do and like the rules and the things that have been put in place by our government that have affected your small business, I just want to acknowledge that we're aware of that and that the things that we recommend society does won't necessarily be the best, like in your best interests.
Right.
A lot of small business that has gone under, and a lot of people with small businesses that have been severely affected by, government encouraging people to do the lockdown and, having curfews, and certain businesses can stay open, certain ones can't. A lot of anger, a lot of frustration. I just want to say that as somebody who works in the healthcare industry, we see you, we recognize it. We thank you for hanging in there and doing your best. And we really hope that, your business was able to survive. And if it's any consolation, I'll be there. I will be back there. I'll be in your restaurants. I'll be buying your products. And it really does stink what happened with COVID. And I hope your business made it. And I hope that you were strong enough to adapt. And for that, I'm sorry, because I'm a person who often goes out and goes local businesses, local restaurants. And I know that COVID has destroyed a lot of that. And I want to acknowledge that. And I want to acknowledge that a lot of the recommendations we make don't jive with your personal life. And, that's all right. And just because we say it's the right thing to do, it may not be the right thing for you. And I just want to say that as healthcare workers, it's hard for us to acknowledge you guys sometimes, but to all the small business owners and people whose lives have been destroyed, very sorry to see that. And I'll be there buying your meals and buying beers at your bar and tipping your waitresses and stuff, because I feel like that's my duty. And I feel for the people who are affected in that way. We come from a perspective where we might seem very preachy and like we're know-it-alls. And yeah, I think we do come off like that. And the people whose lives have been damaged or businesses destroyed or whatever during this, I don't think they get enough respect in that sense. And I'm glad you guys stayed strong. and we'll be there for you when the dust settles, and we'll be there to help support you.
Yeah, I think just even in what you just said, like it takes a community to go through this, right? And it takes each other to uplift each other and get through this. And you know, we've done it already for the past year and a half, and we're still going through it. So we just gotta hang in there.
You're right, and it might present different challenges going forward, and I think hopefully we can all adapt. Hopefully we can come together and try and get past this and get back to a more semblance of life that's more normal. I'm just hoping that going forward we can do it with some more unification, and we can work together and come together as more of a community, and I think we'll be much better on the other side of this if we do.
Exactly. No pain, no gain.
Right.
Fortunately.
Yeah.
Absolutely. Well, it's been a pleasure.
Yeah. Thanks for coming on.
Thank you, Amber.
It's been a great conversation.
Yeah.
Carolyn, I'll see you at work next week.
Can't wait. Tomorrow.
Yeah.
Tomorrow, yeah, Monday morning.
Thanks for coming on, and really appreciate it, and I hope to be hear from you in the future on the podcast, Carolyn. It was awesome.
Enjoy it. Fun.
If we need any sage advice from medical professionals, you're top of the list.
Full disclaimer, the views expressed on this podcast are my own, do not represent the organization we work for.
I just want you to come on and we can just gossip about all sorts of stuff.
Love it. Speaking of gossip, do we want to touch on the Dirty Lou?
Oh, yeah.
I'll let Amber hit it since the younger generation has really reclaimed and taken possession of this nickname.
Right. So, as many of us know, Lewiston doesn't get the rep that I think we deserve, personally. I think Lewiston's a great city, but we get the nickname Dirty Lou, which obviously doesn't come off.
Which, I wasn't born here, but I was raised here from being a year old. I'm raised in Lewiston, went through Lewiston schools, graduated Lewiston High School, graduated Central Maine Community College. Hearing the term the Dirty Lou always made me cringe. And I wanted to reach through the internet and throttle the a-hole who used that term to piss off people from Lewiston. It drives me nuts. In my perspective, we can take away that negative power and we can associate it with more positive things. That is the idea behind the name, the Dirty Lou Podcast. We are taking away the negative energy. And we're really hoping that's the idea. But I am from Lewiston. And for me, when people say the Dirty Lou, it's like, you know what? It's not a perfect city. Are we dirty? Maybe. But you know what? We're Lewiston, and we're tough people. We're adaptable people. We're diverse. And I'm not ashamed to say I'm from Lewiston. So we're taking the phrase the Dirty Lou, and we're trying to take it away from those negative trolls and haters.
And you, Carolyn, what do you think, coming from an outside perspective?
Well, let me just say, Carolyn and her husband, I'm going to quote your husband, Kim, bleeds blue and white. And they do. And I was really had a conversation with Carolyn's husband about this, where they're both not actually, you guys are here and you're very involved in the community, but you're not from Lewiston.
We're not from here, no.
But you guys are here and you're established and you are very involved in the community and you guys are all about Lewiston. And I've always been super impressed by that with you and your husband, Kim.
Appreciate it. My kids were born here, but they probably won't be considered from Lewiston for many generations. Yeah, I mean, I think a lot of people in my demographic are very hesitant to embrace the name, but it's not going away. It's stuck. No, you can't censor people from using it, whether they're using it as, the younger generation who kind of reclaims it and uses it as a sort of way to feel authentic. Yeah, I'm from the Dirty Lou. I'm from a real place. And my patients...
Where the hell are you from?
Right.
Portland?
My patients, I would say all my patients younger than age 25, they love it. And they use it as a point of pride.
Yes.
So it's...
And we've gone into the community and we've asked people and we've gotten the same response. A lot of younger people tend to, it's a pride
They
thing.
love it. So, the reason that I'm here and I'm raising my kids here is because it's a real place, and it's not going anywhere. So I don't know. I don't want to jump in the middle of the debate, but I like it. And I think it's all about how you take it and how you use it. The reasons that Lewiston has been so affected by COVID are structural, and those are the same structural things that lead people to have a negative connotation about the place. You know, the housing is not ideal for the families who live here. The jobs that people work at, they don't have a choice to work remotely, you know? So all those things contribute to why we've had such a high incidence of COVID here. It's not because people are not following precautions or people are vaccine hesitant. It's because it's a city of working families. And
I would just like to toss this out there, which is something a lot of people are not aware of. The first influx of COVID positive patients we had in Lewiston were people who worked at meat factories that were forced to stay open when the pandemic got the worst.
And ironically, you know, the patients who we have who worked at Abbott making the swabs, the rapid testing swabs, which now is the majority of rapid testing, the Binax cards, those were made predominantly by women from Lewiston who carpooled down to Westbrook to the Abbott factory to make those swabs. And so those people who are working in crowded conditions to end the pandemic are the people who ended up having the highest rates of infection.
They paid the cost, or they paid the price.
They did.
But to help the greater good.
Right, but it doesn't make it okay that that's what happened. But
Right.
it's, you know, it's all related to these stereotypes about Lewiston and why it is looked down upon by the rest of the state. So,
But I think honestly, if you're somebody who's ever lived in a big city, you realize that Lewiston is a city at the end of the day.
and it's a very safe city.
Very.
So when you hear people talking about they don't feel safe downtown,
For what?
Go to
Our
down-
crime rate has like gone down. It's like
There's
lower than the state's crime rate,
no
I'm pretty
crime.
sure.
It's like, go to downtown Boston.
yeah, I mean, unless you're involved, you know, unless you're down here to do something unsavory, nothing's going to happen to you. So it's frustrating.
It is frustrating. And I think you said it earlier, Lewiston's a real town. And I think that's what we have going for us. We're real, we're authentic.
Yeah, for
And
sure.
A lot of people like to be in their own little imaginary safe place, whatever, I don't know.
Well, I mean, when I was a junior in high school, I spent 1 year at a different school in Maine, like a really fancy prep school. But if you lived in the town that it was the public school. So I went there for my junior year, and I saw more like sex, drugs, and violence
sure.
in a small town than I ever had in Lewiston.
Interesting.
Yeah, well, it was like way more magnified and way more in your face. And this was a small, dinky town that a lot of people consider real safe, but the social problems were much more magnified and way more in your face. That's my little 2 cents on that. I mean, other than that, I'm like I said, essentially born and raised here. My family grew up on Maple Street when we first came, right behind B Street. Grew up on Summer Street the rest of my life, and I still live here in Lewiston in the Pettingill School area. And I'm not going anywhere. It's very safe. Very.
Very safe.
Definitely.
Wow. Okay, well, we've had a good session here, I think.
Yeah.
Thank you
Thanks,
again,
Amber.
Carolyn, for having us, for being on here.
Love it.
We'll keep doing what we do, Carolyn. And I'll see you at work this week. Thanks, everybody.
Thanks, guys.
Thank you.